When we're helping our clients better understand their Medicare options in San Diego, of course, one of the easiest questions to answer is how much does Medicare cost? But realistically, cost is just one element of the Medicare equation to go along with the doctor's visits, the prescription drugs costs, as well as the benefits, and of course, the cost is a big one. So today we're going to take a survey of the Medicare plans in San Diego and talk about how much Medicare does cost in 2025 in San Diego. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know has questions about your Medicare options, whether it's during the AEP or really all year round, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist you in person or over the phone at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So the question of what does Medicare cost is both simultaneously easy number that you can point out to on a slide, which we will do, but it is also so dependent on specific plans, benefits, and a person's health situations. And the best place to start is what are those set costs for Medicare? Because really any of the costs we are going to talk about for the Medicare health plans, there are going to be an additional cost because of the standard costs that come along with just having original Medicare. The primary set cost on Medicare is the cost that everyone pays for on their Medicare Part B. The Part B cost changes every year, and by changes I mean it goes up every year. But in 2025, it is set at $185 a month. That is the monthly cost for Medicare flat out for most people. Original Medicare has two parts, Part A and Part B. And Part A usually doesn't have a cost because it's something that we have all paid into while we were working. But Part B does. And in fact, to get access to things like Medicare Advantage plans and Medicare Supplement plans, one must have both Part A and Part B. They must keep Part A and Part B to be eligible. So that's the kind of good place to start as far as costs go, $185 a month. Now let's start off by talking about one of the most popular options for our clients for Medicare health options, which is the Medicare Advantage plans. These are private health insurance plans that develop health coverage specifically for those folks who have both Medicare Part A and Medicare Part B. These plans cover everything that is covered by original Medicare and can often include extra benefits like dental or vision or grocery benefits, gym memberships, and much, much more. And also, they will usually include prescription drug coverage as well. Furthermore, these plans are split into two main categories. There are the HMO version of these plans, and there are the PPO versions of these plans, which is a preferred provider organization. When we look at the Medicare Advantage plans in San Diego in 2025, a vast majority of them actually have no monthly premium, in addition to that standard $185 Part B cost. But for a variety of reasons, there are HMOs that have larger doctors networks, maybe larger drug medication availability, or lower costs or copays on those usages, and those handful of plans do actually have a higher monthly premium. The lowest of which is the Aetna Medicare Value Plus plan, which is at $5.90, and the highest is the Sharp Direct Platinum Card plan. And this one sounds like it gives you one of those fancy like airport lounge accesses. I probably should, but maybe they even will one day. But this one is at $51 a month. Furthermore, when we look at the HMO MAPD plans that have premiums all put together, the average in San Diego comes out to $30.78. Again, considerably less than most of the plans that you would get while you were under the age of 65 years old, or something that maybe you would have through an employer or through a spouse's employer, or even a health exchange like Covered California or Obamacare, as it's called in the rest of the country. But remember that monthly cost will include the Part B premium, which is $185, which brings that total cost for the average put together for an HMO in San Diego Medicare Advantage at $215 a month. Still, not too bad, but still kind of a lot. Now, on the other side of these Medicare Advantage plans in San Diego in 2025 is the PPO versions of these plans. And there are far, far, far fewer PPO style plans available than the HMO in San Diego. But they are really starting to grow as the demand for them continues to grow, as well as the number of doctors and hospital networks in San Diego that are starting to become much pickier about the HMO plans that they will accept, if any at all, but the PPO plans, they generally will. This is because the PPO plans normally have a much larger group of doctors and hospitals that can be utilized by their enrolled members. That being said, they do tend to have about the similar cost to those HMO versions of the plans, but the number of PPO plans that have premiums is much, much more numerous. So when we look at the available PPO MAPD plans in San Diego in 2025, we can see the highest cost plan is going to be the Alignment Health Advantage PPO plan at $45 a month. On the lowest end for the PPO plans, there is the Humana Choice PPO that has a monthly premium that is $18 per month. And this would mean the average MAPD PPO plan cost that one could expect in 2025 in San Diego is $34.85. So it is going to be a little bit higher than the HMO, but it's just because the lowest isn't as low and the highest aren't as high, but there's just not as many numerous plans available that are PPO. There's not many of them. Also, when we add that Part B cost in, the average expected cost would come out to $219 per month if somebody wanted to get that MAPD PPO in San Diego in 2025. And last up for today, we're going to talk about one side of Medicare that can be both wild and woolly as far as plan costs go, which is the Medicare Part D portion, or the PDP drug coverage. What this is just and only drug coverage for folks on Medicare. The reason this exists is because original Medicare, Part A and Part B, they do not cover prescription medications, but these Part D plans do. They are run by private health insurance companies that provide coverage for a monthly premium, but it is only for prescription meds, meaning it does not cover doctors or hospitals or specialists or any of the extras, and it doesn't change the way that someone would utilize that on original Medicare. Additionally, it means that folks who decide to just go with original Medicare, they can choose prescription drug plans like these, even if they only have Medicare Part A, or they only have Medicare Part B, or if they actually have both. So kind of all versions of Medicare. If you're enrolled in one or all, then you get the Part D. And that is going to be a big departure from the Medicare Advantage plans or the Medicare Supplement plans that do require you to have both. So when we look at the monthly cost, the range is pretty vast. Because of the lowest cost PDP in San Diego in 2025 is the Cigna Healthcare Assurance Plan, which has a monthly premium of $1.80 a month. While on the high end, there is the Blue Shield RX Enhanced Plan, which is at $183.50 a month. So the chasm between the prices is just so big, and is primarily due to the variability in the types, numbers, and costs of medications that are included on each of these plans. Of course, there is a minimum level of prescriptions that has to be covered, and for the PDP plans, there is no maximum number of prescriptions that will be covered, and those plans that do have the higher monthly premiums usually will also have more options for those medications, not just the minimum. That being said, the average in 2025 in San Diego comes out to $101.44 for Part D plan costs, which is quite high, but I think it is going to be a bit skewed on the average because there are very few expensive plans that are Part D here in San Diego, and then the vast majority of the Part D plans are very less expensive, but they kind of get balanced out by those super duper expensive plans. So if someone does have original Medicare Part A or Part B or both and decides they want to go the Part D route instead of an MAPD plan, they can expect to pay on average $185 for Medicare Part B and then $101.44 per month, which would bring the total average cost to $296 a month for that coverage. So as you can see, the costs for Medicare really do start to mount when everything is added up. The Medicare Part B premium, the monthly MAPD premiums, and even the Part D premiums, depending on the route that someone chooses to go. But whichever way somebody is thinking about, if you or somebody you know has questions about which Medicare plan options they should explore, please feel free to reach out to us at the information down below. Either me or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.